The post-mortem examination of ducks is very similar to the procedure described for chickens. This session will focus on the key anatomic and clinical differences relevant to ducks. During the external examination of the head, inspect the bill. The conformation of the duck's bill is adapted to aquatic feeding. It is flat and has a soft, leathery texture. The color of the bill varies depending on the breed and physiologic state of the bird. Duck hens may develop dark spots or streaks on their bill at the onset of lay, caused by hormonal changes. Note any malformations of the bill. Interruption of bill growth can result in twisting and misalignment. Open the mouth and examine the oral cavity. Mucous membranes should be pink and free of any lesions. Examine the remainder of the duck's head, looking for any evidence of inflammation or ocular abnormalities. One of the main anatomic differences between the duck and other poultry species is the presence of salt glands. The glands are located along the margin of the frontal bone, adjacent to the nasal concha. Salt glands are capable of secreting high concentrations of sodium, chloride, and potassium through slit-like openings into the nasal septum. The salt glands provide an extrarenal pathway for salt excretion, allowing ducks to drink hyperosmotic salt water. Compared to other poultry species, the feathers of ducks are very densely packed together, providing insulation against water and facilitating swimming. Examining the skin and subcutaneous tissues of ducks takes some extra effort, but is a very important part of the exam. Be on the lookout for skin lesions or masses. Pay particular attention to the area around the vent. The vent should be free of swelling or feather staining. Look for evidence of diarrhea or pasting vents. In pasting vents, dried fecal material accumulates around the cloaca. This condition can be associated with incorrect temperature conditions or chronic enteric disease. In male ducks, look for phallus prolapse. The phallus of the male duck is composed of a long tube, normally coiled within a sac in the cloaca. In male breeder ducks, the inability to retract the penis, called phallus prolapse, is a common pathology. This condition is sometimes related to a long and active mating period. Assess the body condition of the duck by palpating the amount of pectoral muscles in the breast region. Note that the conformation of the sternum in ducks is specially adapted to swimming and floating. The breast is flat and consists of large amounts of cartilaginous tissue at the level of the ribs. Inspect the legs. In commercial or breeder ducks, the intertarsal or hock joint is a common place for arthritis and tenosynovitis to develop. This can be recognized as swelling in the hock region. Inspect the feet. The foot pads, webs, and toe joints should all be examined closely for the presence of swelling, wounds, or other lesions. For the internal examination, begin by placing the duck in dorsal recumbency. You will make an incision approximately 6 centimeters distal to the sternum. Using a knife, make an incision through the skin. Separate the skin from the subcutaneous tissue, working in all directions to expose the pectoral muscles and abdominal wall. To expose the neck region, make an incision in the distal neck and use blunt dissection to separate the skin from the underlying subcutaneous tissue. To open the coelomic cavity, use a knife to cut the body wall along the bottom edge of the sternum. Cut the ribs up both sides of the keel and free up any internal soft tissue attachments. Gently lift the keel and do an initial inspection of the organs. Do not completely bend the keel over backwards, as this may rupture the large blood vessels located near the cardiorespiratory system, obscuring your dissection field. To more fully expose the viscera, cut along the midline of the keel and reflect each side of the keel laterally. Examine the trachea and syrinx. In the female duck and goose, the syrinx resembles that of the chicken. Male domestic ducks have an asymmetrical bony dilation on the left side of the syrinx, known as the bulla tympaniformis. Vibration through this structure is responsible for the generation of sound. The outer surface of the trachea should be pink, with white cartilaginous rings encircling it along its length. Inspect the trachea and syrinx for any hemorrhages or other lesions. Adjacent to the trachea lies the esophagus. In ducks, the esophagus should be pink and very elastic. Note that ducks, unlike chickens, do not have a crop associated with the distal esophagus. In the middle of the coelomic cavity lies the liver. It's very important to examine this organ carefully, as many duck diseases are associated with liver abnormalities. In ducks, the normal color of the liver should be dark red and the texture homogeneous. Amyloidosis is associated with a variety of duck diseases and causes an enlarged yellow to orange-colored liver. In immature ducks, it's important to examine the bursa of Fabricius. The bursa is located on the dorsal surface of the cloaca. It can be reached by making a skin incision 2 centimeters proximal to the tip of the dorsal tail. In ducks, the bursa is spindle-shaped. It reaches its maximum size at approximately 4 to 12 weeks of age and normally regresses by the time the duck reaches sexual maturity. Make an incision through the outer wall of the bursa and examine the mucosa carefully, looking for any hemorrhages or other lesions. The remainder of the necropsy exam in the duck should be conducted in the same manner as the procedure demonstrated in the chicken. This concludes our demonstration of the avian necropsy examination. For educational purposes, the authors have presented a complete necropsy examination. With time, you will soon develop the skills and judgment necessary to perform an efficient exam. While each step of the exam may not be performed in every case, it's important to become comfortable conducting a thorough examination. Practice is the only way to truly master these techniques and to develop the experience necessary to be able to differentiate normal from abnormal findings.